Growing pains are one of the most common causes of pain in children, but they're also one of the most misunderstood. So in this video, I'll explain what you need to know and what you can do at home to help. We'll also go through a few common conditions that might be confused with growing pains. And by the end of this video, hopefully you'll feel reassured and also know when to make contact with your doctor. Please remember this is an educational video and should not replace medical advice. However, we hope it helps. Let's get started. So what are growing pains? Let's start with the basics. Despite the name, growing pains don't actually come from growth spurts or bones stretching. That's actually a really common myth. In fact, studies show there's no link between growth rate and pain. So your child isn't in pain because they're growing too fast. Growing pains are what we call a benign pain syndrome. That means they're harmless and they go away with time. They usually happen between the ages of 3 and 12, and they're most common around the age of 8. Now, these are the typical symptoms. The pain is in both legs, often in the calves, thighs, or shins. It comes on in the evening or at night, so it may wake your child from sleep, but by the morning, they are usually completely fine. Now, take note of this next bit. Growing pains should not cause a limp. So if your child starts limping, make sure they get a medical assessment, as it's probably not due to growing pains. Sometimes growing pains can happen after a busy, active day, but it's not an injury or damage to the muscles and joints. In fact, the research shows that potentially up to half of all children experience growing pains at some point, so they are considered quite common. Now let's focus on how to recognize true growing pains. Just quickly before we move on, if you're finding this video helpful, please tap the like button to support our work here on YouTube. So how do you really know if it's growing pains? The diagnosis is based on what your child reports and experiences. You cannot diagnose growing pains from scans or tests. So here's what to look out for. The pain affects both legs, not just one. It's usually in the muscles and not the joints. It happens in the evening or at night and goes away by the morning. Your child can walk, run and play normally during the day. There's no swelling or redness in any of the joints. And often a gentle massage, a warm compress or stretching often helps. And I'll show you how to do that later in the video. So if your child reports these symptoms, you're likely dealing with growing pains. If your child reports different symptoms that don't fit this pattern, then make sure you get a medical assessment. In this next section, I'll talk about when you should be a bit more concerned. So this part's important. Growing pains should never cause daytime pain, swelling, or limping. So if your child has any of the following red flags, it's time to see a doctor. I'll just quickly talk through them. Pain in one leg is rare, especially if it's always in the same spot. Swelling, redness or heat in a joint or limb, limping or refusing to walk, pain that's still there in the morning, and pain that's linked to activity or worsening over time. Also, if the child shows any signs of fever, fatigue, or being generally unwell, if any of these are present, then it's not growing pains and you should get a medical assessment as soon as possible. Conditions like juvenile arthritis, infection, or vitamin D deficiencies can mimic growing pains and need medical input. Now, this next part of the video may be what you were waiting for. What causes growing pains? The truth is we don't fully know, but research points to a few possible causes, and it could be, of course, a combination of factors. So there's the fatigue theory. After a busy, active day, tired muscles may simply become sore in the evening and at night. There's the bone density theory, where some studies show that children with growing pains may have slightly lower bone density, making their legs more sensitive after activities. But the research is very limited, and this is certainly far from conclusive. Low vitamin D levels are common in children with growing pains, and supplementation can often help. It's also been linked to emotional factors. Some children with growing pains show higher stress or anxiety, which may make them more sensitive to pain. So it could be a mix of muscle fatigue, bone density, vitamin D status, and how the body processes pain. But the reality is the cause of growing pains does remain a mystery. So in this section, we're going to look at what you can do at home. Now, the good news is growing pains are completely harmless and self-limiting. They will pass with time, but there's plenty you can do to help your child feel better when they occur. Firstly, you can reassure them. So following a medical assessment, you could explain that growing pains don't mean anything is wrong. The pain can be strong, but it's not causing damage. Next, let's have a look at massage. Gentle rubbing or kneading the sore area often helps the pain settle quickly. Here's a demonstration of some massage over the skin and using some simple self-massage tools. A warm compress, heat pack, or even a warm bath before bed can relax the muscles and ease the pain. Stretching the calves, thighs, and hamstrings can reduce pain at night. These stretches can be completed before bed or when the symptoms come on. Now hold each stretch for at least 10 seconds and move through the different stretches, repeating if needed. If your child has frequent pains, you could ask your GP about checking for vitamin D levels, especially if they spend little time in the sun. In the UK, the government advice is that everyone should consider taking a daily vitamin D supplement during the autumn and winter. Overly tired muscles may trigger more night pain. Remember, there's no harm in gentle activity, and children with growing pains don't need to stop playing sport unless you feel they're simply doing too much. In this next section, we'll look at what's not growing pains, or what we might call common lookalikes. Now, let's clear up one of the biggest myths. Not every leg pain in a growing child is growing pains. Here are a couple of common conditions that are different and need a different approach. Sever's syndrome. This is pain in the heel caused by irritation at the growth plate where the Achilles tendon attaches. It usually affects children between the ages of 8 to 12, especially those involved with running and jumping sports. And the pain is worse with activity, and it's unusual to have night pain. If your child's heel hurts when they're walking or during sport, and it's tender to touch down at this point here, then this is not growing pains and it needs more careful management. We've got a really helpful video on Sever's disease on the YouTube channel, so I'll put a link below and a link at the end of the video. Next, we'll look at Osgood-Schlatter's syndrome. This is pain and swelling below the kneecap where the tendon attaches to the top of the shin bone. It's common in active kids aged 10 to 14, especially during sports like football, gymnastics, or basketball. Again, it's worse with exercise, and you might see or feel a small bump at the top of the shin. Again, we have a great video on the YouTube channel on Osgood-Schlatter's, so I'll put the link in the description below and at the end of this video. And finally, if your child complains of back pain, then that's not growing pains either. Growing pains affect the legs, not the spine. So persistent spinal pain always deserves a proper medical checkup. So as we get towards the end of the video, let's look at when to reassess or get help. If the pain pattern changes, for example, if it becomes one-sided or starts affecting daily activity, or your child develops any red flags that we mentioned earlier, then make sure you get a medical assessment. Remember, growing pains should never get progressively worse, and they should never cause swelling or limping. So before you go, let's quickly recap. Growing pains are common, harmless, and temporary, usually in both legs at night and gone by the morning. Not linked to activity or growth spurts, helped by massage, warmth and stretching, and of course reassurance. They're not associated with swelling, limping or back pain. And if you ever see any of the red flags, especially the persistent one-sided or daytime pain, it's time to have your child assessed by a medical professional. So if you found this video helpful, please consider sharing it with other parents or perhaps on parenting groups on WhatsApp. If you're watching us here on YouTube, I'll put some other helpful videos showing on the screen now. Thanks for watching. See you in the next video.